of, work home environment. Good afternoon, everyone, and welcome to our Ask the Researcher. My name is Kyleigh LiPira, and I'm so excited to be here today with Dr. Adil Daud from UCSF. Today, we're going to have a really great conversation with Dr. Daud and learn a little bit more about what he's doing at UCSF for the melanoma program. We're going to ask him a lot of questions about the impact to research because of COVID-19. And we're also going to share information about the first annual virtual San Francisco Gala, which is happening next Thursday, June 18th, honoring Dr. Daud and the melanoma program at UCSF. So we're really excited to have a conversation today and learn a little bit more about Dr. Daud and share critical information with you all about what's happening. So it is my pleasure now to introduce Dr. Adil Daud, who is the clinical professor of medicine and dermatology and director of the melanoma program at UCSF. Welcome, Dr. Daud.
It's great to be here, and thank you for having me on.
Great. Well, we're thrilled to have you, and I know many of our viewers are going to be very interested in what you have to say. So let's start off with just having you tell us a little bit about the program, the melanoma program at UCSF.
Great, awesome. So our program here is a multidisciplinary program and currently has 19 members, and that includes medical oncologists such as me, and also Dr. Katie Tsai and James Lee. It also has surgeons, Dr. Michael Alvarado and Dr. Jonathan George. Also has radiation oncologists, radiologists, dermatopathologists, who are pathologists who specialize in looking at the skin pathology and specialize in melanoma. And that includes Dr. Boris Bastian, who's very well known for uncovering the role of different genes in melanoma, Dr. Yve Ye, and also includes radiologists and nurse practitioners, nurses, program members, program staff, which many people might have interacted with. So one of our functions is to treat melanoma, to do research on the causes of melanoma, preventing melanoma, and and especially during these interesting times now, to where there's this COVID-19 pandemic raging in our country, and we'll talk about it in a few minutes, but just making sure that essential melanoma treatment continues at this time.
Yeah, absolutely. That is so critical, and certainly it's top of mind for many of the patients and caregivers that the MRF interacts with. So Dr. Daud, you have been involved with the MRF for many years. Way back in the day, I think you were also honored when we had our in-person San Francisco Gala with our humanitarian award, and you've certainly been a huge advocate for the work that we do. And we're so excited to honor you and your team next week virtually. So why don't you just tell us a little bit about how you've been involved with the MRF over the years?
Great. It's awesome. I mean, I want to say this is my 20th year as a member of the Melanoma Research Foundation. And I've been involved many years, including my first job out of fellowship was at the Moffitt Cancer Center in Tampa. And that's when I first was introduced to the MRF and the important work that the MRF does. And I've worked as both to raise awareness with many MRF programs, but also to review grants for the MRF. And I'm part of the MRF Breakthrough Coalition, where we are looking to accelerate new therapies for melanoma and support the tissue banks and the virtual repositories that MRF has created and participated in many of the MRF clinical trial efforts, and also strongly support the work that MRF has done bringing melanoma and melanoma research to the forefront of our nation's, legislators and politicians, and to prioritize melanoma research, which I'm glad to say that we've made a lot of headway in the last few years, and just making this a priority for clinical research and for translational research and for basic bench side research.
Yeah, it's been amazing to see how far we've come. And I mean, you've certainly seen that in your career, just the major breakthroughs in research and treatment. And it's all because of the research and the groundwork and the amazing work that has been put in, but not only by our physicians and researchers, by the patients as well who've participated in these clinical trials. And, one of the things that we're doing, which is very different for the MRF, is that we are going to be funding a grant back to UCSF to help support research from the proceeds of the gala. And normally, when we raise money at these events, the money is all pooled together, and then we grant out research grants across the country. But in this case, we really want to support UCSF directly and help get research back up to the level it was certainly before COVID-19. So I think at the top of mind for many people, they're really wondering, how has COVID-19 impacted research? Because we really know that research is the key to the next FDA-approved treatment, the next big breakthrough. So certainly, since we all went on lockdown in mid-March, can you just tell us a little bit about what's happening in the research space?
Sure. It's been a huge, it's had a huge impact on us. Ever since March, since the lockdown here in California, basically all of our clinical research staff and laboratory research staff who are considered to be non-essential workers have been working from home. And in many cases, they're able to do the stuff that they need to do, but in many cases, that's not possible when you're working from home. And so just to give you a few examples, like, for example, we have a clinical trial where we collect tumors, make a vaccine for patients, and then deliver it along with immunotherapy. That's the clinical trial. So we are not able to ship samples out, and we are not able to transport samples collected from patients to our laboratory or to other laboratories as well. So unless it's considered to be clinically necessary, like for example, for pathology reports. So that has essentially meant that those types of trials are on hold, because obviously if you can't ship the tumor, you can't look at the neoantigens, you can't make a vaccine, you can't really administer it. And one of the major focuses of my research has been trying to understand what makes a tumor responsive to immunotherapy. I mean, we know today that there are tumors that are responsive and tumors that are not responsive. And for lack of a better word, the ones that are responsive, we call them hot because they have a lot of T cells, they have a lot of dendritic cells. The immune system is doing a lot of stuff there. And cold tumors are ones which are kind of like immune deserts, just don't have a lot going on. So working with Mike Rosenblum, who's a researcher here, we've shown that you can extract T cells from tumors. You can look at them with using flow cytometry, and if you have a certain kind of T cell, that's a hot tumor. That's a patient who is likely to respond to immunotherapy. And we haven't, for the last couple of months, we haven't been able to do that anymore because you just can't transport samples, and that type of research has been shut down. And most of the labs here, including Dr. Bastian's lab, Dr. Shane's lab, Hunter Shane runs a lab here, and Eva EA runs a lab here too. All of their labs have been essentially on working on lockdown, meaning that nobody is allowed to come into the lab except on some occasions just to feed cells and just to keep cultures and mice going. So essentially any kind of research activity per se is not allowed. Now, gradually we are letting staff come in, but they have to stagger shifts, and only one person can be in a certain part of the lab at one time. So that essentially also means that just maintenance activities are going on right now until we restart back up. And for our clinics, we are not allowed to have, or currently we don't have clinical research coordinators in the clinics. So we can't consent patients, or we can't, collect biopsies, or for example, if you want to put a new patient on a clinical trial who we think might be a good candidate, we are using DocuSign and Zoom to call in patients and basically send them forms, and then they sign them. But that's a lot different than the way we used to do things previously.
Wow. So there's two things that you said that really struck me. So the first is that you can't send these tumor specimens, right? So there's kind of like this shutdown in information sharing, so to speak. So I guess the first part of my question is, by not being able to do that these last few months, like how far does that set you back in terms of just data collection in general? Like in that normal time span, if everything was normal and great, you would collect 500 specimens, so to speak. How has this set you back in terms of just collecting that data from tumor samples?
Yeah, it's an enormous setback. I think just speaking for ourselves, we've lost about 6 months worth of research because from the very start of the pandemic here in February, we were advised to stop a lot of research activities. And just to give you an example, we have a study right now where we collect melanoma tumors, and we basically extract T cells from them. We make what's known as an organoid, where we basically try to reconstitute in a petri dish the tumor immune system, and then we add novel checkpoint inhibitors in that organoid system. And then the idea is to see if T cells are stimulated or not, and potentially to figure out what kinds of novel treatment a given patient might respond to. I think we are far from being there, but I think this type of research can help us to understand, like a human being's immune system versus in a mouse model where many of these checkpoint inhibitors have been tested, which we know that the mouse immune system is very different from ours, and a lot of immune therapies work great in mice but don't work great in humans, and vice versa. A lot of immune therapies, like for example, PD-1 doesn't work well in mice, but works good in human beings. So I think the idea is to try and see how we can look at this human organoid system. But essentially, for that, you have to not just be able to do surgery, which we have restarted surgery back like a week and a half ago. So we weren't having any surgeries. So that has tremendous clinical implications, I would say, that we're worried about delayed diagnosis, about delayed treatment, and we are beginning to see some patients who, for justifiable reasons, simply haven't gone to the doctor, or simply haven't, gotten their exams, and then now we are seeing some delayed diagnosis, which in itself I think is life-threatening. But just speaking for the research part of it, if you can't do surgeries, you can't collect tumor, you don't have a lab that's working, you're not going to be making organoids or doing anything like that. So a lot of translational research, which really depends on people in the clinics and ORs talking to folks in the labs, that's just not going to happen in times like these.
Wow, that delayed diagnosis point too.
Yeah.
I mean, that's huge for somebody who's high risk of of melanoma, or again recurrence. That's a pretty scary thing. One of the other things that you said earlier that again struck me was clinical trial accrual. you graciously spoke on a webinar that we did a couple of weeks ago on clinical trials. And, to your point, if you don't have a nurse in there accruing trial patients, I'm sure that clinical trial accrual has really slowed down. Has that impacted the success of clinical trials? Has that impacted the timeline of clinical trials? Can you chat a little bit about that?
Yeah, I think absolutely it has impacted all of those things. Clinical trial accrual, is a real time kind of thing. So in our program, we accrue somewhere between like 50 to 100 patients a year on clinical trials, and part of that is just having clinical trials that are attractive to patients and having obviously having patients who are interested in those clinical trials. But we've had so many patients now who needed to go on clinical trials or been interested in going on clinical trials, but it's their in many instances they are scared to travel, and so they don't want to be on the highways or on the planes coming in to see us. We have folks who live in Nevada or in Arizona or New Mexico who fly in, and we've done the most we can do to space out treatments, and in some, and this is one of those instances where using delayed treatments, like for instance doing treatments every 6 weeks or every 4 weeks instead of every 3 weeks or 2 weeks has helped. But a lot of those are patients who are in whom existing treatments aren't working, and so they really need to go on to something, and with to try novel treatments, whether they're novel antibodies or novel immune treatments or targeted therapies. And if you can't go on a treatment, and you could just imagine from February to we're in June right now, that's a lot of time, and that has not everybody can even avail of that clinical trial if you delay like a accrual for that many months. And we're seeing unfortunately that happen too, where that time that's right for you to participate is past.
Yeah.
So but yeah, it's hard to describe the full impact of this.
Yeah, and we probably won't even see the full impact for a while, to be honest, right? It's, I think for any cancer patient, time is of the essence, always. And when you layer on top something like this, it's incredibly challenging. And, when you gave that 50 to 100 number of clinical trial accruals a year, and you take 6 months out of the year, that's pretty significant when you're looking at the number of people that you can actually accrue to a clinical trial in 2020.
Yeah, absolutely. So that basically that number translates to somewhere between 4 and 8 patients a month. And I can tell you that February, March, April, May, our accruals have been a big fat zero. So now towards the end of May and beginning of June, I think we are getting back on track, and we're now allowed to have a single clinical research coordinator present, but our clinical research staff has 10 people on it, and that's because the complexity of today's clinical trials is such that there's a lot of paperwork, there's a lot of safety issues involved with clinical trials, a lot of sample collection, and so if you have just one person in your clinic, that's a big difference between having 10 people versus one. And so even today, we're having to prioritize what type of sample collection and what type of work we are able to do purely for patient safety. So we are not collecting data like, for example, for pharmacokinetic studies and EKGs and all the monitoring that we like. Sometimes we do, certain types of imaging for research purposes, and we are currently not doing that. We are only doing imaging that's needed for clinical care. So like just to figure out if somebody is responding to treatment or not.
Wow.
So
certainly have had to pivot quite a bit. Well, let's talk a little bit about what this award is going to mean for your team. So obviously the MRF is going to be hosting this virtual gala and honoring you and the melanoma team at UCSF. And our goal is to raise as much money as we can to help your lab, to get things back up and running as quickly as possible. We know that it's not going to be like the MRF office where we go in and flick on the lights and turn on the photocopier and we're back in business. We know that it is a huge operation to run a lab and keep a lab going. So maybe you can just tell everyone a little bit about, what's the impact of that grant going to mean to your team and the lab at UCSF?
I think it has huge impact on us, and I can't describe to you how important it is to us, but I just want to emphasize the importance it has, especially for some of our junior investigators who are maybe thinking of devoting their careers or at least a significant portion of their careers to melanoma research, which we know that beyond my career and beyond of us, all these, it's a lot of younger investigators who are just getting into clinical research or translational research or lab research. Like in my case, I mentored 3 individuals. They're fellows, they're clinical or translational researchers. I think it's going to have a huge impact on them because it allows us to fund their work for the next few months and maybe for the next year, and allows them to apply for NIH funding. In the case of Dr. Levine, she has gotten an award from ASCO, but she's today or the next month or so, she's applying for NIH awards. And it's important to show preliminary data. That's the thing that's most important for you in order to get an award, is to show that you have a track record of productivity. And of course, you can show productivity if you've been sitting at home doing Zoom calls. Does not generate data, and so it extends the timeline, and you're able to get back into the lab. You're able to generate data, and it just gets you that breathing room that you need to apply for grants. So I think in the case of Dr. Lee and Dr. Huppert, that's going to be vital for some of our junior investigators to get to that point where they can apply for grants. And in the case of us more senior investigators, it lets us continue research where, like we were talking about a minute ago, you haven't really collected patient data and you really haven't collected tumors. So it lengthens the year for which we might have maybe 6 months left at this point this year to try and get as much data as you can in the 6 months that are left of this year.
Yeah, absolutely. And at the MRF, we believe so strongly in funding young investigators, keeping them in the field, because we know how competitive it is. We know how challenging it can be. And, I can't imagine spending my life, again, trying to prove something in a laboratory. It's a long game. It's not a short game, as you know. And, the more we can do to keep these people in the field to hopefully find a cure for this disease is really the goal. So we're thrilled on behalf of the MRF to really support your lab and keep people in the lab collecting data and moving the needle forward, which is the goal, especially with everything that we've experienced over the last 4 months.
Yeah, thank you. And I just want to thank you on behalf, and thank the MRF on the behalf of many investigators at UCSF who have received MRF funding over the years. I can't describe to you how important it's been, because that funding at a critical point in your career can keep you going and can keep your research viable, and especially for a period like that where essentially we're all facing several months of lost research and lost data to try and squeeze the most we can out of the rest of this year. I think that's what we're all thinking we're going to do, is like work twice as hard in from up to December of this year and try and get that momentum back up.
Well, you already work hard, so I don't know how twice as hard. You're not going to sleep, I guess. It's the plan. Well, Dr. Daud, thank you so much for joining us today. I want to express our appreciation to you, to the entire UCF Melanoma team. We are really excited to celebrate next Thursday and to recognize you and hopefully raise a lot of money to support your work and really get the cure off the shelf, so to speak, and really move the needle forward. So again, thank you so much. And I hope all of you will join us next Thursday for our first ever virtual San Francisco Gala. Our chance items, 2 trips, are available now for purchase. You can purchase your tickets. And again, you have a chance to win 2 trips. Really wonderful. I think we're all in need of a vacation right about now. And our silent auction is again opening this Thursday. So please register, bid on items, help support Dr. Daud and his amazing team at UCSF. And again, on behalf of the MRF, we're just grateful for your support. And Dr. Daud, again, thank you for all you're doing for the melanoma community.
Thank you very much. And thank you for the MRF. And yes, please attend the virtual gala and please bid so that we can continue our work and bring melanoma advances in melanoma care to as many people as we can.
Great. Thank you.